Hey Yonkers, it's Mayor Mike Spano. I'm also joined with the Superintendent of Schools, Dr. Edwin Casada, is off to my left, and Dr. Mark Samarne, who's on my right, my immediate right, and obviously on my far right is the Deputy Mayor for the City of Yonkers, Jim Kavanaugh. In attendance with us also the head of our Office of Emergency Management, Mike Masiello. So Mike will keep some social distancing, and we'll stay, but we'll bring him in if we need to have a discussion with them. Just an update. We're trying to do now a weekly up-to-date to the people of Yonkers. Currently, as of yesterday, there are 1,275 confirmed cases of corona in the city of Yonkers. There are 25 confirmed city employees that they're non-police and fire. We have 3 confirmed cases in our fire department, and there are about 64 related COVID-19 cases in the police department. I say related, they're not necessarily infected, but you've heard me use the word affected through family or other issues that have required them to stay quarantined. The business of Yonkers is proceeding as usual. Well, as usual as can be expected. Our city services continue to be provided despite the effects on our first responders, our police department, our fire department. They are operating near 100%. In the case that where they have to do something that's very much related to their job other than COVID-19, they are there and they're available, fighting fires, protecting you against criminals, and keeping you safe. So, we want to say thank you to our police and fire. I also want to say thank you to Empress and the EMS. They have been just golden for us here in Yonkers. They're out there, they're providing essential medical services. They're going right into the lion's den each and every single day. So they have to be, we have to commend them for some very difficult work they're doing. And as you know, this is probably, I know how the doctor talked about, this could be our worst week. We will have a discussion, because I think we need to have a discussion with the superintendent of schools. We'll talk about our kids, talk about how they're handling what's happening, maybe offer some tips to the parents on how we can best give advice to you as to how you can best deal with your young ones in terms of making sure that you keep them interested in education and keep them motivated to do the things they need to do. The weather is getting nice, and so no one's going to want to hang out home, especially a teenager. And so we're going to have to do our best to explain to them what's happening and how it's important for the next week. We follow the rules that the governor has put forth. Every single day, I have watched the governor. I pretty much watch the governor and get my reports from the Department of Health. Many of you have said, well, why not hold press conferences every day? And I don't think that that's something that the public really wants or needs at this point. I think we need to listen to, we have one leader in the state, that's Governor Andrew Cuomo. We are abiding by his wishes. He's doing a fantastic job, and we are, because in a time of war, you need one person who can run the show, and that's what we're doing. We're being good soldiers. We're doing the things that we ought to and should do to protect the people of the city of Yonkers. Before we go into any Q&A, and I hope that many of you have questions and you'll put them on Facebook so we can answer them. This is a good forum for us because it's a very local forum. This is not something you're going to see on the networks, but it's something you'll see on Facebook and something you'll see in social media. So I'm going to ask, I'm going to start off with Dr. Mark and just ask that he say a few words about the current state of affairs and what's happening in terms of our hospitals and our healthcare facilities. And that's one other thing too. Let's thank the healthcare workers. I was able to stop at St. John's I delivered some pizzas. It was just a little something to say thank you for the healthcare workers who are frankly out there working every single day, working double shifts. Many of them aren't going home, but they're sleeping in their cars because they don't want to take the virus home to their families. These are truly committed people, and we have to thank them as well for all that they do. So with that, Dr. Mark.
Thank you, Mayor. So the Yonkers hospitals have a number of beds that are available. We are obviously treating patients, and we have the capacity to handle the patients of Yonkers. We have the capacity to handle the patients of Yonkers, and we're also seeing patients from neighboring towns, even the Bronx. The physicians are prepared with techniques such as using BiPAP machines in certain ways and splitting vents if need be. The number of critical care providers has been increased, so we have more physicians and people taking care of these patients. As far as at St. John's, we have 60 internal medicine residents and emergency residents that have also shifted to help the people that are in most need. As far as the staff, we really would like to thank the nurses, the nursing aides, the transport, the lab, the respiratory therapists, the sanitary staff, the radiology, and the administrations of both hospitals, because they've really worked with us and tried to help us tremendously.
Great, thank you, Doc. You know, it's interesting because, you know, more as time goes by, you realize all the different people you need to thank. You take the sanitary staff, which here at City Hall, which really have been the Teamsters, have stepped up to take that role. And so I want to say thank you to our Teamsters. I want to say thank you to our CSEA workers who are out there doing what they can for us too. Just looking at the notes here, one of the questions was, are businesses practicing proper precautions for COVID-19? And obviously we have a number of departments, codes, buildings that will go out, will enforce the law, especially as it is in today's environment. But we're doing so in an effort to bring them along, not so much that we're trying to be heavy-handed, but we are just ensuring that they practice social distancing. If they are a business that must be in operation, we also make recommendations for a certain number of people. If you go to a supermarket, to make sure that there are only a certain number of people in the stores, and we obviously are advising them as a good practice so that they can practice disinfecting. Is it perfect science? You know what? Nothing's perfect today. We all know that. But you know, that's why we ask the viewers here to be the eyes and ears. Call the Mayor's Helpline, 377-HELP, if you need to report anything that doesn't look right to you. And just let us know so that we can put forth and send forth the proper authorities and make the necessary changes. There was another question here that some of you have seen new uniforms similar to what the police uniforms, similar to what the CDC wears, and why is this the case? Well, obviously we need our police officers as protected as possible. They are the ones who are called to the scene. They're the ones who go when there's a problem. So they're going to be the ones that more than likely will be in harm's way, while the rest of us can, you know, scurry about and stay away. They can't. They have a job to do. And so what we do is we make sure that they all are taking proper precautions and wearing the appropriate protective gear. And going forward, though, we will ask that all of our first responders, when they are interacting with the public, that they are wearing masks. We have here with us the superintendent of schools. Probably the toughest job in the city right now, it seems to be the superintendent of schools. This is the 4th largest school district in New York State. Dr. Casada has almost, well, if you include the non-public school kids, he's got well over 30,000 young people that we need to make sure are getting an education. And so I want to ask, I know there are a number of questions here, but I'd like to ask our superintendent of schools to say a few words. Doctor.
Thank you, Mr. Mayor, and good morning, everyone. And Mr. Mayor, thank you for providing this forum for us to speak directly to our community. I think it's a great opportunity for us not only to answer questions for the community, but also to share information. I too want to join you in saying thank you to our first responders. Phenomenal job they've been doing in Yonkers, and I think those of us that are not involved in that are extremely appreciative, and we support them and send our prayers to them as well. As you know, Mr. Mayor, and to the community, we in the education system are responsible for 3 very specific mandates that were sent to us by the governor. One is continuity of instruction. The other one is grab-and-go breakfast and lunch for our students, and the other one is child care for some of our first responders. Let me start with child care. Thanks to you and your support, we are providing child care in 2 schools to at least 20 families of first responders. We appreciate the fact that you identified the funding for us to pay 2 organizations that are providing those services. As it relates to grab-and-go breakfast and lunch, we have grab-and-go breakfast and lunch in 8 different schools. That has been going very, very well. We are providing breakfast and lunch to over 2,000 children on a daily basis. And I must tell you, our food service personnel is doing a magnificent job, and I extend my gratitude to each and every one of them. And to my central office team that is leading that effort, especially our director of food services, Ms. Taft, doing a phenomenal job making sure that our students who may be impacted and may not have breakfast and lunch, that we are providing it to them. And then the final one that we must provide is continuity of instruction. And I have to tell you, we in Yonkers, we are very fortunate. Over a month ago, we began planning for where we are today. And I must tell you that my teachers, my central office team, my administrators, they have done a phenomenal job as it relates to continuity of instruction. Most of our work is being provided directly by our teachers, who use different platforms to provide instruction to our students. But in addition to that, the district created a robust website. If you go to YonkersPublicSchools.org and you visit electronic learning, you will see a tremendous amount of activities for our students to complete. So parents, please visit that website because you will find a lot of great information. This week, we are mainly dedicating this week to the arts and physical education activities because we want our students to stay fit and also to ensure that they are doing arts activities in addition to doing the work that their teachers are assigning. So go to that website and you will see a lot of information there. For those families that do not have electronic devices, we are mailing packets of information to them. And in addition to that, we already started a distribution of laptops to our families, those that may not have hardware at home. So right now, we have distributed over 500 laptops to our students. We are expecting another 300 laptops to arrive this week, and we will also be distributing 150 iPods to our pre-K to grade 2 students, so that for those families that do not have hardware, that they can come and receive them, and we are here for them. We are working collaboratively with our families, our administrators, our teachers, our civil service employees, and the idea is to ensure that our students are learning. That's more important than anything else. Families, remember that we are just learning a little bit different. But everyone must remain committed to doing the work. June will be right around the corner, and you must be able to demonstrate as a student that you completed the work that you have been assigned to and the work that you were expected to complete. So the work is going well, and as always to the families, if they need to reach out directly to me, 376-8100, or better by emailing me at ecasada@YonkersPublicSchools.org. Thank you, Mr. Mayor.
Thank you. Now, I ask that any of you have questions for Dr. Casada that you post them to us, and what we'll do is we'll kind of go back and forth for the next 20 minutes or so, just to make sure that all questions get answered. Dr. Mark, are the hospitals in Yonkers prepared for those who need hospitalization and ventilators?
Yes, the hospitals in Yonkers are prepared. As I said earlier, we do have a number of vents that are available. Our physicians do have the capability of converting certain BiPAP machines and splitting vents if that were needed. And if we do need vents, hopefully we'll be able to get some more. Our governor is working on getting us some more vents for the whole state. We have increased the number of critical care personnel that are working. We have our medical residents at both hospitals that are working. And as I said earlier, everyone's working around the clock to keep everyone safe and to get everyone treated. So far we're holding our own.
Okay, thank you, Doc. One of the questions that one of the viewers has asked is, would you consider let's go back to the first responders, that you would wanted to know, aside from first responders, why are tests not being offered to, let's say, sanitation workers, custodians, restaurant staff, etc. And right now, the practice across the country has been to give the healthcare professionals and our first responders the first crack at the test. They are pivotal to dealing with the crisis. Those of you, though, who who feel that you might have the coronavirus, obviously need to contact your healthcare provider, contact your doctor, and don't go in. Make sure you make the phone call, and they'll more than likely get on the phone with you and or get on FaceTime with you, and we'll give you directions from there. And before I go into the next question, Doc, maybe you want to address that real quick. Because I think we could say this over and over and over again. So if you think you have it, what do you do?
If you think you have it, if you're showing signs and symptoms of COVID, and the signs and symptoms have changed, as opposed to just the cough or the shortness of breath and the headache, patients can have GI symptoms. Call your healthcare professional, discuss things with them over the phone. You can call the health department, and I'll share those numbers in a little while. Stay home, self-quarantine, call your doctor every day, check your temperature every day, and just monitor yourself closely. If you live at home with people, try to stay away from everyone. Stay in a room on your own. Have them bring you the food. Just try to minimize contacts as much as you can, because many patients do have the disease, but they have mild symptoms, or they may not exhibit much of symptoms at all. And these are the super spreaders, if you will. These are the people that are going to spread the disease through the community. So if you feel sick, stay home.
Great, thank you, Doc. And why does Yonkers not have a testing site yet? I mean,
Well, we don't have a testing site yet. We neighbor New Rochelle, and we neighbor Valhalla. So patients can easily get to either site, and the number of kits is also limited. We really have to treat patients in the hospital to see if they have it or not. As more kits, I think, roll in, perhaps we can start to introduce more test kits to the primaries and the physicians and the community, and maybe even have a test center. But for the foreseeable future, I think the New Rochelle and the Valhalla centers are the two that are going to be available.
Thank you. And one of the questions here is about hotspots in Yonkers. I'm assuming nursing homes, assisted living facilities, high populated areas are the hotspots that we're looking at in Yonkers?
As far as hotspots, there are a few things. Dense areas are going to have more people. If there's more people, there's less of a distance between people, so they can spread things a bit more easily. Now, the nursing homes and the assisted living facilities, many of these places have patients that are compromised. They have the elderly. They have those that have diseases like diabetic, heart disease, lung disease, risk factors which would increase. Our fragile population lives in these facilities. So having one resident that has it, a disease like COVID-19 can run rampant. And we're seeing it in nursing homes, and we're seeing it in assisted living facilities for those reasons.
Gotcha. Thank you. Thanks, Doc. I know that there was one question here about confirmed cases with the homeless population. I'm assuming that there are some, but no one has specifically made that aware to us. But again, remember, there are certain rules and laws that we have to abide by in terms of reporting. So that's probably will make that information a little more difficult for us to get. But we may get a name, but we're going to get an address, and that's about all we're going to get. Dr. Casada, are all the I have one question here, is that are all the Yonkers teachers, the CSEA employees, are they going back, do you think they may go back to work on a rotating schedule?
Well, thank you, Mr. Mayor. Well, our teachers are working from home, and they are working with our families and our students on a daily basis, including this week. Our CSEA employees, they are all on a rotating basis. For the most part, we are, and some of them are on call, that you only come to work if we call you to come to work. Our custodial staff, they only work about 4 hours a day. They come to the school, and they are expected to observe all of the COVID-19 guidelines that have been described by you and by the doctor. So it's important that everyone understand that the majority of our employees are working from home, and we are only bringing essential employees on a rotating basis. Again, we want to monitor our buildings. Most of our schools are fully closed. As you know, only 8 schools we are providing grab-and-go breakfast, and we are following CDC guidelines as it relates to providing guidance. So the answer is our teachers are working from home providing services, and our CSEA are either coming for 4 hours a day or on a rotating basis. The idea is to limit the number of adults or individuals at any site. We do that in central office, and we are doing that in each and every one of our buildings as well. One of the questions, if you don't mind, Mr. Mayor, was do parents have option to opt out in observance of Easter holiday? Certainly we were supposed to be on spring break, but the governor mandated that schools stay in session this week. And for those of us that are observing the Easter holiday, what I tell everyone is that you may use a religious observance day. So parents, work with your teachers. If you will be observing Easter, particularly Good Friday or Passover, please notify them that you will not be completing your work because you are observing your religious beliefs. Okay?
Great.
There's another question here.
Sure.
Where can children receive tablet? As I indicated before, we distributed already close to 500 laptops. Unfortunately, we do not have the hardware for every student. We are expecting another 350 laptops. We have about 340 families on the waiting list, so we will be distributing those laptops to those families. The best way to be on the list is by calling 376-8000 and asking for Dr. Arias' office, and there they will take your information and have a laptop for you as well.
Great, thank you. And that reminds me of 2 things, too. One, Dr. Casada was talking about the breakfast and lunch. Remember, most of our population lives, or our school population lives at or below the rate of poverty, and many of our children don't know where their breakfast is going to come. Dr. Casada and his team have made breakfast and lunch available as it is during the school year, because we certainly want to look out for our young people. We want them to learn, but we want them to be healthy as well. And as far as the laptops are concerned, we're going to see what we can do to get some additional laptops for the Board of Education, but at the same time, we want to thank Altice. Altice has made available to families who are struggling through this time, who do not have service to Wi-Fi, a 60-day period of free service. So I want to say thanks to Altice for that, and you might want to just go on optimum.com and find out how you can access that. One of the questions, what is the city doing to enforce social distancing? Again, our police department is out there. They're in full force. They're doing what they need to do. When they see crowds, they disband them. We have not gotten to the point where we have issued tickets yet, though that's something that may happen. But we're asking that we look out and police ourselves at this particular point. We don't want people to have to stay indoors, though we think that that's the best thing to do. Stay indoors, stay away from others. But if you feel that you need to go for a walk, certainly do that, but practice good social distancing. That will proceed as it is now. If things kind of get out of hand, then we'll be forced to maybe issue, like they're doing in New York City, to issue a summons to people, though I'm not really interested in issuing summonses at this point, but I will do what I need to do along with the team here to protect the public. The sanitation workers are continuing to do what they do for us each and every single day. They're picking up trash on a regular schedule, and we are working with the Teamsters on making sure that they have the proper gear to protect themselves from the pandemic. And we're also working with our police department and our local hospitals and through our Office of Emergency Management. And I'll ask Mike if you want to come over and just answer one question. One of the questions is, do our police department have enough PPEs?
Thank you, Mr. Mayor. I would say at this point, everybody, all our first responders, police, fire, were issued masks. We're still working. Our supply is limited. It is okay for now. We got a great deal of volunteers, a great deal of people that donated, which is awesome from the citizens. But we also are working on acquiring, as you know, both surgical masks and N95 masks and gloves. So we have a great deal of orders in there. We're looking at probably another week or so before we start really getting all our orders in. But at your request, we ordered more than enough, and we're also making sure, as you asked, to all our city employees that are dealing with the public on a regular basis, tax office and things like that. So I would say we're in okay shape right now.
Great, thank you. Thank you so much. One of the questions here is about non-essential employees still going outside their homes during this time of crisis. No one is saying you shouldn't, you don't leave your home once in a while. If you need to do a little exercise, if you can practice good social distancing, and you can make sure you disinfect yourself as best you possibly can. Those are important three components. Also, while you're inside, think about your neighbors. We have firefighters, police officers, city Teamsters who all volunteered their time to the office of, to the Kelly Chiarella and the office of, Office of Aging, sorry. And so they delivered 2,300 meals the other day. So they're there, they're available for seniors who are at risk. But think about your neighbors, think about who is around you, especially if they're a vulnerable population, if they're a senior citizen, or if there's somebody with a compromised immune system. You can do a lot for those people without actually coming in contact with them. So what we're doing is we're going out, we're delivering meals. The meals are being delivered at the door. Some of the city employees have actually gone as far as to adopt a senior citizen. So to go out, do a little bit of shopping. Again, bring it to their door, put it at the door. Don't have any interaction except by telephone. They call them once a day. Spend a little time on the telephone. Seniors love that. So for the Yonkers residents that are out there, think about this. Think about who is living around you. And how you can communicate with them, call them up. They're sitting at home by themselves. Sitting at home by themselves. You know what a phone call would do for that person? Hey, what do you need? And while you're out shopping, pick something up for them and take that bag or take that food and drop it at their door. These are things that we're doing, but these are things that you can do for the next week. Hey, you know what? The week is going to go by. It's going to get very boring, right? So let's think of ways that we can be more helpful to our neighbors. Dr. Cassano, one of the questions here is, what do you think about schools reopening? Or do you think that they're closed for the year?
Thank you for that question, Mr. Mayor. And my dream is that we will open schools soon. Certainly, based on the data that we are all viewing, that will probably be difficult. However, all of the guidance related to when schools will reopen are driven by executive order from the governor. So we are hoping that we can eventually reopen school this year, but we will expect further guidance from the governor related to this. And related to that, Mr. Mayor, if you don't mind, I also want to say thank you to Kelly Gioriola. Some of My Brother's Keeper students are volunteering to distribute meals to our seniors. So that's also happening here with our students who are volunteering to provide support. One of the questions that came was, how are you dealing with kids who have IEPs? Students who have individualized education plan are treated the same way that every student is treated. They must, teachers must provide instruction to them. And I want to remind our families that they must utilize their school's website, because in their school website you will see your teacher's schedule of instruction for that day, and in addition to that they will be able to see the assignments that the teachers are providing. And I want to tell our families, do not wait for a laptop. I am on the Yonkers Public School website right now using my cell phone. So please utilize your cell phone to find out when your teachers will be available and the assignments that have been assigned to them. We already begun for our students with disabilities, OT and PT. We're going to continue speech. So we're going to continue to provide all of the services to our students. We're not going to treat anyone different. Our teachers are expected to do the work with our general education students, our students with disabilities, and our multilingual learners. In addition to that, I want to tell parents that if they go into our website and they click on distance learning and then they go to programs, they will see a lot of information for what they can do with students with disabilities. So that's extremely important. I also want to add to what you were saying regarding distance learning. This weekend I received calls from neighbors of some of my schools where some adults are utilizing our fields to do contact sport. I just want to tell the community that we will be closing our fields. We do not accept anyone to come to do contact sports in any of our field. So I called the police was notified, and we will work collaboratively with you and the police department to ensure that our fields are not being used for that. One of the questions was about graduation, Mr. Mayor, and I always want to speak to my seniors. One of the first messages that I sent out when this began was speaking to my 12th graders. I want to tell my 12th graders that you must continue your work. Your graduation is coming. Your acceptance to college is coming. This too shall pass. What we do not want is for June to come and for you not to be able to demonstrate that you completed the expected work. So 12th graders, 8th graders, complete your assignments, because you will graduate if you complete your assignments. We will receive additional guidance this week regarding Regents exams. I will be sharing that information as soon as I get this information from the Board of Regents. But most importantly, to our 12th graders, stay in contact with the college that you were applying to. Make sure that you get that acceptance letter, complete your work, and I'm sure that we will come up with something to graduate and celebrate each and every one of you.
Dr. Cassano, thank you so much. Again, thank you, your trustees, your support staff, the administrators, teachers, these CSEA workers. You're doing an amazing job. And our kids, know that this is, like you said before, this too shall pass, but we have a lot of work to do. One of the questions I got here was about New Rochelle getting aid and assistance from the state. Now, Yonkers has the most cases. New Rochelle, as you know, was the hot spot of the pandemic. In some degree, it still is. Though the area has expanded. It should surprise nobody that Yonkers has 1,200 cases. Yonkers is the largest, most densely populated community in the region aside from New York City. And so should not surprise anybody. We are getting a tremendous amount of support from the governor. The governor's people have been in constant contact with us, and have made available to us resources that we've needed. The county executive, George Latimer, has been in constant contact with us, and so is the Department of Health. And so we have a lot of support from a lot of people, and of course, you should be assured and feel be comforted by the fact that your city employees continue to do everything they need to do to operate the city, to keep the city moving forward, so that we can get past this as quickly as possible. I know that the deputy mayor is here. I didn't ask him to say a few words, but we'll see if he has anything else to offer that you think we may have missed.
Well, we're starting to look ahead a little bit to the day when we come out of this. And so we're trying to, and the question was, what kind of help does Yonkers get? We're starting to think about what help we can provide. So as we look forward to next year's Community Development Block Grant application process, we're going to be reaching out to the community organizations that provide services in the community and figure out how we can send those resources to people who have been impacted economically or in other ways by the current situation. The other thing we're doing is we are setting up a resource for small businesses. We know how many people have been impacted. Small businesses have had to close. Some are wondering if they'll ever reopen again. So many people have been laid off, lost their jobs. So our Department of Planning and Economic Development recognizes that they will probably have to incorporate economic recovery into their mission. So we're setting up a website. I believe it is smallbiz@yonkersnewyork.gov. That's B-I-Z. And we're going to have a person in the planning department who is going to be able to provide advice to small business people as to what programs are out there, how you can deal with the state or the federal government to get assistance. So there are a lot of ways you can go directly to the state of New York, but here in Yonkers, we're going to provide a helping hand to set small business people up with those government programs to get them back on their feet. So there's a lot we can do, and we're starting to think about how we can do that. Thank you, Mr. Mayor.
Thank you, Mr. Deputy Mayor. And just so you know, too, one of the questions was why isn't the County Department of Health sharing the breakdown of deaths in the city of Yonkers, and that's been a number that we don't, frankly, know. It's a moving target, but we're working in the county now to get those numbers so we can share them with the residents. We're going to wind this thing down, but I wanted to couple of things. There were a couple of things I want to address. Number one, I want to offer my condolences to families that are experienced the loss of a loved one. I think it's safe to say that we all know one or more people who have suffered and who have lost their lives due to this pandemic. So I want to offer my condolences, my sincere condolences, and all the people of our city. This is a lonely time, too, to lose a loved one. I lost my aunt a few days ago, though it wasn't the COVID, but I lost my aunt a few days ago. And having to be able not to go to the service for her and for my cousins is a very, very difficult time. But know that this pandemic will pass, and we'll have opportunities, to be together later, and we'll have opportunities to mourn the loss of a loved one later. So to keep that in the back of your mind. The other thing, remember, it's Holy Week, and while we have not even been able to go to service, we've not been able to go to we weren't able to do Palm Sunday, at least in a church, though I did it on TV. Know that Holy Week is here. This is our highest holy time, and so I want to wish every one of you a wonderful Easter, and say a prayer, and continue to pray that we will move past this pandemic, and get on to normal life sooner rather than later. Doctor, what did you say? Oh, okay. So we know that before we end out, the doctor has a few more questions to answer. So, Dr. Moore.
Thank you, Mayor. So we had a few questions, and one of them was where to test if the primary doctor does not have any test kits. Test kits are scarce now. So there are two places, Glen Island and New Rochelle, and the number to call for there is 888-364-3065. Again, that's 888-364-3065. The other facility is in Valhalla, Westchester Medical Center, and the number for there is 914-202-4530. Again, that's 914-202-4530. The hotline, the COVID hotline for the public, for the Department of Health, would be 866-588-0195. And the local St. John's Community Hotline, where people can call during the day, is 914-964-4706. Again, that's 914-964-4706. A few questions that came in are about the hospitals being at capacity. As you know, our governor asked to increase capacity to 150% for the hospitals, which we've done, and we're above our normal capacity at the hospitals, to answer that question. The other question was about a test to look for antibodies, and we're currently working on that. We're hoping to get it soon. This way we can test everyone to know who has antibodies, who's immune, who's recovered. This will give us more data, but we don't have the test currently. That's it.
Thank you, Doctor. And again, and I'm glad you brought that up too. Special thanks to St. John's, St. Joseph's. Special thanks to Lawrence Hospital, which is not in Yonkers proper, but certainly right on the line and very much a part of Yonkers. To those facilities, every one of those facilities have increased their capacity over 100%, and that's a testament to the doctors and the support staff there. We know our healthcare system is stressed, so we need to do our part. Stay home, stop the spread. If you need to go out, make sure you disinfect, make sure you practice social distancing, and only do it just to get a little bit of exercise and come back home. With that, we'll get through this week, and hopefully we'll be able to see the numbers start to decline in the next week or so, I hope. Again, I'm not an expert, but you just got to listen to the experts and see what they say. God bless you all. Enjoy the holiday, and we'll talk to you again next week.